Good afternoon and welcome to the 24th episode of Genomics Gupshup. Genomics Gupshup is Mapmygenome's initiative to spread awareness about genomics and to get experts who will help us simplify and understand genomics further. Today we are delighted. We have Dr. Ashwani Dhar from California. He's a physician leader and he wears many hats. Welcome to the show, Dr. Ashwani.
Thank you, Anu. Appreciate the opportunity.
Dr. Ashwani, I know you wear many hats. Can you tell us a little bit about the many different things that you do?
Yeah, with no hair, so you have to wear hats, but I'll tell you a little about. So I'm a doctor, and I used to say physician, but in India I don't say doctor. So I'm a doctor, and have been in the healthcare IT field for a decade, and recently been part of a few startups in the US. A medical device startup, and I'm an advisor with a healthcare IT company and also an advisor at UCSF Health Hub. So that's kind of my US engagement, and I've recently started some engagements in India as well. So I'm a co-founder of Avenida Innovations, which is basically in the world of PharmD, a bridge or a catalyst between the academia and the industry, and also another company which is into clinical trials, a site management organization, and a group which is Think Roman, WebMD meets telehealth, and we also have a digital magazine, Orzu, so a nice time to pitch for it, orzuv.life. So it's a kind of a digital medical health and wellness magazine. So that's kind of a summary of most of the things I'm involved in right now.
That's fascinating and amazing. So, how did you first think about becoming a doctor? Was there some lot of family? How did?
So I think I should kind of give my tagline. So I'm a proud Kashmiri by birth and American by choice. But in Kashmir, when I was growing up, most of the people were either becoming engineers or becoming doctors. And I can make up a story that I saw it on the TV and all. I think it was organic. And I always was fascinated by kind of doing, like people who are sick, or then it was not preventive health at that time. It was like taking care of disease. So my thing or the dream was to go in and help people. And that's why I did like residency in general surgery as compared to internal medicine, because I had this idea that you go and make a change and come out. So that's my journey into getting into medicine. And then when I went out of the country, I got exposed to medical informatics. So I have a postgrad training in medical informatics from Royal College, Edinburgh. So that's my kind of journey. And then I live in the Bay Area. It's a hub of startups. So I saw everybody in that. I said I should get some part of the action as well.
So you went from India, you studied your medical thing in India, then you went to UK, and then to the US. And then you got involved in many different.
Yes, I think this was I think I have to say that in America you can be who you want to be, what you want to do. You are your own limiting factor. So I took the opportunity and tried these different fields, and this India engagement has been very rewarding, and it's great to be because of Avenida Innovations, I get to talk to a lot of young professionals who are at different parts of their journey, and I'm not an expert, and I say that in every kind of gathering, or I recently was at a conference which Avenida did for 1,000 people. I always say that I'm not an expert, I'm just sharing my journey. So if professional life is a kind of a freeway, so I'm a few hundred miles ahead of you, I can tell you which exit not to take. So
I like that, because many times when we are talking about genomics also, I tell them that it's not that you can't go somewhere, but we'll help you to navigate better, right? So in some ways, we say it's like Google Maps. It will tell you.
Absolutely, it's kind of a GPS tells you where to go.
Yeah. So you mentioned PharmD. So who exactly is a PharmD? Who chooses, like, what does a PharmD person mean?
So I'm glad you asked me that question, because if you were to ask me a year back, my understanding of a PharmD person was a person who has training in that area and is part of the care team. But unfortunately, that's still work in progress in India, especially the clinical pharmacists are not part of what you are used to in the US. And PharmD is mostly people who want to be part of the healthcare and take the pharma stream of education, and it's a 6 years course, and they're quite embedded into healthcare in terms of doing internship at hospitals and all. But there's a lot of work that could be done in India as far as their importance and their being embedded in healthcare and planning treatments and not just be the person behind the counter giving medications. And Avinida is trying to make that change, as I said, being a bridge between the academia and the industry and being the catalyst.
And a lot has happened in the space of pharmacology and pharmacogenomics has become now quite an integral part at least in the US and now in India as well. So do you think there's enough education of pharmacogenomics across the world, or how do we,
So I'll give you my thought. So at least till a few years, most of the people thought of personalized medicine only in the terms of oncology. In fact, when I had the opportunity to be a panelist at your launch recently, it was good to see that people understand, and when you introduce your product, that there are regular medications which your body it would be good for you or not. And I still remember one of the genetic persons talking about her son who had an injury in the arm, and the kid was given paracetamol and codeine, and then he was drowsy, falling all over the place, and they figured out that his body was converting paracetamol and codeine into morphine. So you could be doing more harm such a patient coming to the ER. So I think there's a awareness, but is it enough to be a part of a regular intake of a patient, like you do a hepatic panel or renal panel, to do this as well? I think that needs more education and awareness. That too, even among the clinicians, not only the public, because they're the drivers, and if they understand the value of it, I think let me put it this way. There is awareness, but there is a lot of awareness to be happening, I guess.
So we've started the process, but we're not quite there yet. So one of the things we realized was that there were some doctors who were looking at one specific part, like when they were in the process, that was part of the process of looking at medication. Then they had to do a genetic test to understand that. What we realized is that this is something you do once, right? You don't have to keep doing it again and again. And if you did the whole profile, ideally as soon as possible, then there's a possibility of having that as part of your medical record, right? And I don't know how quickly that will happen, but I think if it happens, I think a lot of current adverse effects that happen today hopefully can be avoided in the future. So do you think that that's something that people will,
I guess there are two ways I'll try to answer it. One is that in my healthcare IT world, I've been part of one of the two largest EMRs, so electronic medical record, which in the adoption of that in the US is kind of very, very high. I don't know how much of that is in India. I would like to see that in your electronic medical record, or the patient's medical record, or patient's health information, this test should be part of it. And as you rightly said, it's done once and it can carry on, and then you could be, especially if it is available at the time of the patient or a person coming for healthcare, and especially in areas of ER, then you could be preventing harm. Exactly. You would not be giving, in this case of this young boy, you could not be dosing them with medicine which is doing harm. My idea, at least I'm a big proponent, and I have been talking to people after your launch, that it should be a part of your record or medical record. And there is, of course, cost effectiveness and other things to be viewed, and how it can be packaged so that it's bang for the buck for the people as well. But I guess clinicians should be leading the charge of making people aware that the importance of it, and making it easier to understand by giving examples of like the example I just said. Because people don't need to have PhD when they say genomics and it's something kind of rocket science. That in your day-to-day life, it could have a lot of effect. You are gulping or taking a lot of medication, and that might not be effective. Not only it's not effective, it could be doing a lot of harm. So I guess clinicians need to be leading the charge, and also general awareness by doing some camps and all.
Because I think in India, one of the other problems we have is that the access to medicines is relatively easy, right? I mean,
yeah, tell me about it. So it's like, yeah, you could go and shop for medicine, and I mean, I'm not comparing US to India. They are really very cheap. I don't mean quality, but the cost.
correct.
And you don't need to ask anybody. You can just go across the counter and, you go in an ice cream parlor and ask tutti frutti butterscotch, and you can have this antibiotic. And I mean, in US, you won't get an antibiotic if it's not prescribed. So OTC is okay, but here you can you can walk up to a pharmacy and ask for anything. So yeah, there isn't the danger, but I think that's a larger issue. But one could go in the healthcare facility and the healthcare providers and make them aware of the importance.
Okay. Because I think one of the bigger challenges is, especially if they are having more than one drug, right? So you have like 2 or 3 drugs, sometimes those drugs will interact. And I think it's very important, like you mentioned, the Tylenol and the codeine case.
Yes.
So now I think what we are seeing is a lot of hospitals are reaching out to us and saying, for our patients who are doing multiple drugs, right? So a polypharmacy sort of thing, we want this to become a protocol, right? That becomes, I think, it becomes necessary for a lot of people, because I think people who have diabetes also have hypertension and vice versa. Right? There are many diseases they coexist in some form.
Absolutely. Comorbidities, I mean, a typical patient has hypertension, diabetes, and something else. We talk about clinical decision support, CDS. I think this is the next level of that, so that if this is also part of that algorithm, so you're adding not only doing drug-to-drug interaction and drug-to-food interactions built into the system, which is called as clinical decision support offerings for systems. This should be part of that, because then it really adds up to not just that typical adverse reaction, it is that the other layer of it. I would say that people who are involved in creating the softwares and all should plug this into it as well. So I think there's a value to that.
So I know that at least in India, sometimes people tell me, "Us doctor ki dawai mujhe lagti hai," right? And I think part of that is because many times those doctors are understood your family history, and they know what has worked for your patients, and they're also very experienced. But not everybody is, right? And I feel that if we are able to bring in a little more objectivity, then the possibility of saying that I only need somebody who has 20 years of experience will go away, right? You can at least bring in some amount of objectivity in being able to work for medicines to work well for everyone. That is.
Yeah, I'm glad you kind of mentioned the subjectivity of medicines. I mean, you'll have in families, people say, when I get headache, I don't need to do anything. I just take this med and takes care of me. And there might be basically a pharmacogenomics at the back end. And I guess subjective is okay, but we need to have an objective, scientific based, if it's even validating that part. But I guess there is an opportunity to get this mainstream. It should not be, as I said, personalized medicine is not only oncology. It's like, as your test helps you categorize 165 meds, and those are the most commonly used. So it's like your cheat sheet that what works for me, and that should be part of your record. Absolutely.
Because I think the challenge is you can't be doing. It takes a few days to get like a whole profile done. So once you're done, but you're done for life. You don't have to keep doing it every time you take a new medicine.
So it's like you have your blood group in the files. This should be part of that.
So what you asked a little bit about in the Indian system. I think one of the things they're trying to do is to create this whole the India stack that you have currently, like your UPI and all that. So similarly, they're building for the medical stack. So hopefully the health stack is called. So hopefully we will have
this as a component of that.
Yeah, it would be a nice thing to have, because ultimately everything will interface with the.
So again, it is for the clinicians to make people powers to understand the importance of it, and then people who are not clinicians and others understand the importance that what it gets for the general public. I think there should be kind of value add for that. Absolutely.
So which I know that you you said that oncology was what you thought was the main reason main area where people look at pharmacogenomics. Are there other things that you feel clinicians should be more aware of at the specific areas? Or?
I think cardiology is one, and I think there is a lot of movement in this. I think cardiology would be, and these are the three comorbidities, and I think cardiology should be one, and with our kind of predisposition in our countries, I think there should be more clinical awareness of clinicians driving that let's say do it in cardiology or cardiology clinics and wherever there are chest pain clinics and all, they should make it as a part of the protocol that you presented, and one of the tests you're doing is this one as well. So I think so.
So where else do you see genomics? I know you're also an investor in the clinical trials company.
The clinical trials could be that could be various flavors of it, and you could see what produces better results and relatively and again objectively finding. There's a lot of scope in that, and I think it could come from both sides, the industry as well as academia, and there could be some middle ground where both parties invest into it and have, ultimately it's like, how do you have better outcomes for the patient? So this could be one of the factors where both parties, there's always collaboration between the two parties, but this could be, you could have three players in it. You could have academia, you could have industry and the clinicians. So, industry could be like you or pharma and a combination of that. I think there's value to that.
So you work with a lot of students as well, right? So what would you advise them to do? Pharmacogenomics, regular like where would you advise students now? Like what areas should they be looking at in terms of newer areas for?
So as I said, my engagement with the students in India is very recent. So I'll be very kind of candid about what I can say, and most of the students who we interact with because of Avenida are in the PharmD, and a lot of them want to say that what should I do next? And my kind of guidance, I'm not a career counselor or an education counselor, but I tell them look at things beyond, like think outside of the box, and pharmacogenomics could be one, and there's medical informatics, and a lot of people don't know that there's a fields where your domain knowledge and a combination with, you don't need to know coding and software, you could be the bridge between the data or people who are software creators because of your domain knowledge. Here you can create a clinical decision support system, or you could be part of creating a software which could be doing gene sequencing or whatever. So your domain, healthcare domain knowledge could be used, and you could go for a master's in those spaces, medical informatics being something, or pharmacogenomics being something else. And you could also go to the counseling part of that. I mean, you could help the clinicians understand what the test results are and drive that as a consulting or counseling service. There are a lot of opportunities, I guess.
I think a lot of people are not yet aware when they enter, but they can. So when we create our teams, also there are people who come from, the science part of this thing. There are some who are IT, and then when we initially started Osimo a long time ago, I remember that people got fascinated because suddenly there were these people who initially majored in biology and medical sciences and all that, but they moved to IT because that's where the jobs are. And so when they suddenly saw that there was something like which combined their two skills, they got very excited. And I think similarly, when you mentioned you have people who come from a PharmD background, they understand the domain. They can be as like the domain experts, or they can also become somebody who knows if they've moved into IT, they can come back and be that bridge between the two as well.
So I call it the intersection of technology and healthcare, and I joke about it that I've been to both the sides, got lost and found my way. But absolutely, I think there is, healthcare is getting digitized in various ways, in various forms, right from pharmacogenomics to use of AI in pharma. There's a lot of opportunity, and that's what I tell students, that you are on a stream, there are other parts, so keep your eyes open, and you could, depending on your interest, go into other streams which combine, as I said, I know I'm kind of sounding like a broken record of domain knowledge, and go into other areas and add value to, ultimately, I always believe that how do you improve the patient outcome? So this is the road towards that, and you can have different tools in your toolkit to do that.
So are there other areas of genomics that you find fascinating?
So
and need not be anything that.
So I think then it's like how there's a lot of, I don't want to call them fads, but these are real things that what food you should be taking, nutrition, and there are so many things. You could map out your ancestry. You could map out the foods that go with you, and maybe start a business out of it, and that consult that this is the nutrition you should be taking. And I don't know what else will come out of it. And I just want to be on the science side of it, that these are some of the areas I think that would be of value. And there's a definite science about it, which you would say that this food, I do well when I eat it. There may be a reason for that. So that's it.
So actually, we do have products in that space.
Okay, so that's a good way to pitch that. But a lot of people are aware of those.
Yeah.
But how much is the awareness in a percentage point? I think there's still a lot of work needs to be done. And now that we have different mediums, when people say pharmacogenomics, people, as I said earlier, don't need to know that they have to have a PhD on something. As we socialize it as a regular thing, as any other test, I think that's where we need to put our, so to say, money, that making people aware, whatever is the way of awareness, whether it's seminars, webinars, or maybe even going to a high school where they're doing a science project and making somebody as a pharmacogenomics ambassador or something. I'll do that in high school. Yeah, that's a great idea for you. Free.
So I think 11th, 12th is a good time, because that's the time they
people are aspirational and they want to. Yeah, you should have a Mapmygenome ambassador who kind of socializes it in their school.
I think we can definitely try. I tried to make, so my daughter is in 11th grade.
Okay.
And I keep trying to, I realize that, their textbooks are, they can see some of it, a lot of stuff is written, but I think, if you can sort of make it easier for them to understand in real life, I think then it becomes easier for them to sort of even,
So I think, I don't know how much of your, we are sitting in your office, and how much of that is kind of, you can maybe have a school trip organized for people. I mean, as much of the areas you can see, and get them to your conference room.
We've had a few people like that. We've had some, but it also takes up a lot of.
I understand, time, space, and people, so I understand. But I think the ambassador thing might not be a bad idea now that I'm thinking aloud. That might be a good thing for them to be the conduit between you, or things, pharmacogenomics, and the students. And a lot of people might make it kind of dumb it down, that this is not, you don't need to go to masters in biology and then understand what's being said. Yeah, that might be a good idea, yeah.
You can give everybody a different, like the gene names can become like fun characters.
Yes, why not, yeah. And people are open to all of this. It's just that we need to walk that a bit, so that they understand that this is nothing like out of the outer space or something.
So, is there anything else you want to talk about, or I will go into some more interesting rapid fire questions?
I'm always okay
Ready
for rapid fire, as long as you don't ask my Swiss bank account number or anything. But
that was what I was going to ask.
So, yeah, I think this has been a great journey for me, the India part of engagements, and it's fascinating to see. I know it's kind of sounds cliche that India has such a big pool of young talent, and it is amazing to see the opportunities out there. And I think India has changed a lot, and there's a lot of encouragement for people to be entrepreneurs. So I see startups all over, and the thing is, there's the talent pool, and there are consumers also. They're consuming information in a different way. Today you could have digital healthcare because that's what the people have grown up with. I kind of, people call me the new fanboy, but I think there's a lot of opportunity in all the spheres, right? From people having cosmetic startup to like Olas and electric scooters. This is the place to be.
Absolutely. So I know one more thing that I found out today about you.
Yeah, what's that?
That you are also a model.
No, that's kind of a.
Or were a model.
Yeah, I mean, it was like
You are a
shot.
model that people look up.
Yeah,
Like,
that way I don't know, but
role
yes.
model, but when you are modeling as a role.
Yeah, so yeah, that was like when I was just like out of med school, and it so happened somebody said that you have a portfolio. I didn't know what that means, and so we went around with the suit I had and got a portfolio then, and they told me, do you want to do a shoot for a suit? And so I said, yeah, sure. And lo and behold, they had a tall girl, and they made me stand on 2 bricks too. That was not good for my ego because I think I'm a tall guy. And ultimately, I found out that was Sushmita Sen, so who became like the Miss Universe, So I have the bragging rights of that. So that's about it. So that's a fun fact.
Yeah, that's an amazing fun fact.
Yeah, it is. It's
So-
more of bragging rights.
Maybe it's also for Sushmita Sen. No?
No, I don't even know that I exist, so I don't want to get into that part of it. And people are like, okay, really?
Yeah.
What are you smoking? Okay.
So I'll move on to the rapid fire then.
Bring it on.
Okay. Which is your favorite movie or a book that you can tell us?
So book, I think The Count of Monte Cristo. So that's not a very well-known book, but I like that book a lot. Yeah. So movies, I'm a fan of Godfather. So yeah.
And also you like one particular actor.
So actor in India, I'm a fan of Amitabh Bachchan.
Yes.
So I've grown up with his movies, but what I really like about him is reinventing himself. And not that he's on every endorsement, but obviously people want to pay him to be on those. But like reinventing himself, like at today's, like he's an icon and still is directed by like 25, 26-year-olds. And that shows that he wants to be in the craft. And yeah, I'm a fan. I'm a fan of Rajnikant also, so I can do the spectacle.
Yes.
Yeah.
Sing, yes.
Yeah, absolutely. But, yeah.
So, if you are a Kashmiri by genetically, you are a Kashmiri.
Yeah, I'm proud Kashmiri by birth and American by choice. Yes, absolutely proud of being.
So, have you done your? You haven't done your ancestry analysis yet.
No, that's kind of a sore point, and especially living in US, everybody, all my friends in America have a full tree going on. We have a little 2-3 branches, and I'd love to. And I hope that we have more people participating. I mean, we can't bring the dead back, but
So
at least from here onwards.
We'll do the heritage and see. So what will happen if you find out, let's say you're from, and does it matter where you come, like if you find out that you were 80% Kashmiri but 20% something else?
So if you were to talk to me like 15, 20 years back, I would say, oh, that's cannot happen. Today I don't want to say the way it's going to come out. I don't care, but I'm grateful to God or whoever you want to believe in for the life I've lived, and I wish everybody the childhood I've had, and I'm lucky to have a great partner in life, my wife. So yeah, it doesn't matter where I came from. I think what matters to me is where I'm headed, and what am I making in my own way a small contribution. That's what matters. I was joking with somebody, not joking, I was talking about that. Something like similarly what you... I said today, if somebody were to tell me in a Bollywood style that we found you at the shrine outside wrapped in rags and now you are... I said it wouldn't matter to me at all. I'm the person who I am today, and the love I received, the affection I received, I wouldn't change that for anything.
So were you a good student or a bad student in high school?
A very, very good student. Gold medalist, and my name is in the honors board and so on. So yeah, it kind of seems like flaky and childish, but I'm from a school in Kashmir called Bisco, and I'm proud of that. Yeah. So there are 2 schools in kind of Kashmir which have a rivalry because of the girls' school involved. So, so there's a Biscuit school and there's a Burnham, and a proud Biscuit school. Yeah.
So was there any subject you were bad in?
I think when they
were worse. I'm sure
so relatively, yes. I think I was
yeah.
so when I was a student, we had to study Hindi as a language. Like Hindi, I was not now. Still, when I see, like I told you, Amitabh Bachchan, I follow on Twitter. So he writes some of his tweets in Hindi. So I have to kind of add that together. So to answer your question, that was my kind of week. I was very good at sciences, so physics and all. So I used to love that.
So that's where you. That's what you've been doing mostly.
Yeah, so that was my favorite place. Yeah, absolutely.
So you're productive in the morning or the night?
I'm an early morning guy, and you don't want to mess with me till from 7 to like 6:30 to 11:30 or 12. So some of the people would avoid having meetings with me because
So your brain is most active at that time, or
absolutely. So I'm a morning person. In fact, even weekends I kind of get up and do.
I want to understand this from a genetic point of view because I've had many people. Some people are totally morning people. Some people are, they become active at night.
So I'm a morning person, and I still continue to be a morning person. In fact, when we go, my wife and I go on a vacation, so I get up early in the morning and do my tour of the place by the time she
wakes up. Yeah. So which is your favorite vacation spot then?
So we have traveled. God has been kind. We've traveled a lot, and I think I like Europe for travel. Would I live there? No.
But what if you find out that was your little bit of the 20% genes?
So maybe that's so. I like Italy a lot. I like Rome a lot. This was a kind of a first. I would like when we started traveling. I said no, Italy. I don't want to go to Rome.
You do look a little bit Italian.
So I don't want to say that on the camera about things. So they're the most relaxed people. I mean, if you've been there, so you go to have lunch. Even if you sit for 6 hours, nobody's going to come with a bill and all. But I also like Lisbon a lot. I like Portugal a lot, and what it's laid back. And in fact, I was at one time thinking of buying a place there. So I like it. And there's a lot of Asia we've been to. So we've traveled a lot.
So anything that you want to ask me or
so I think one of the things we've just had this opportunity, and I did not know that till I came to your office that you do a podcast. And so what made you do this? I mean, what was the kind of, how did you stumble, or was it organic or?
Yeah, so essentially we were, I think some of our senior members of our team, we were sitting and chatting and upstairs. We haven't yet seen our terrace. We were sitting over there and chatting, and then I said, you know what we should do? We should get together on the Saturday afternoon and then talk a little bit about, work we do. Because I think it's important to break it down for the average person. And, it started off with exactly just talking about that. So the first episode is actually, we were upstairs, I had a whole bunch of people, and I basically got the head of the lab, and that was how it got started. But we realized we were not that great at, creating, it was not easy in the open space to sort of build that. And over a period of time, I think that we built this genome studio, and that's how it got started. So now we get doctors, we got somebody from a nutrigenomics background, we got somebody it's basically now become a good place, and I think Gupshup, so that, it's not something, everyone's used to giving talks. Because the problem is a lot of times there's a lot of great content on genomics, but it's all as a talk, and I think normally people don't have the time to
engage and spend that much time.
Yeah.
So tell me about, so that this is something I discovered today, you're like teas and tea, so tell me about, and I saw your collection of blue tea and all, so tell me a little about that.
Yeah, so I think tea is exciting for me because it's sort of like, for all of us, right? It sets some sort of a mood in some ways. So for me, it started off with my, as a young girl, I remember studying for exams, or in the winters, you drank Brahmi tea or something else. So over a period of time, I think what my mom and dad gave me. That sort of evolved, the taste evolved. Then you travel a lot, like you mentioned, you travel like that. I love traveling. Sometimes even when I go for work, I go
take it at some time off.
And then I visit the tea shops and I started collecting teas. And then I started making my own concoctions. And as a result, I think, I realized that there were different teas I liked. So some teas I like in the morning. I'm more a night person. So, I now am trying my hard to sort of increase how much I sleep because I was sleeping very less. So then I discovered some of these teas that will allow you to sleep. Then there's some teas that allow you to, focus and so on. So it was all like putting and experimenting because I think, my mind's constantly thinking about new things, and I think it's a great place to sort of. And I think you like teas as well.
Yeah, absolutely. So we have a lot of not as big a collection as you have. So, which are your top 3 teas?
So,
or exotic, which you can.
I like the blue one for the color. Right?
Yes, it's amazing.
It has lots of antioxidants, but it's just fascinating. The color, just how it looks fresh and dried both. And then if you add lemon, it becomes purple. So it's interesting in that sense. Right?
Visually,
it is very appealing. Then I like a lot of the I do like lemongrass sometimes in some combinations. So sometimes I add a lemongrass with some other thing. But I also like saffron in a lot of teas.
Okay, so saffron, yes. The best saffron is from Kashmir. So.
Yes.
So I have a friend from Iran, and we always kind of do that. But yes, saffron.
So it's very interesting. Once I remember this. So when my dad passed away about 8 years ago, and there was this neighbor, and usually during in Rajasthan when someone passes away, you get people send you food, right? So our neighbor used to send us this saffron tea, and it was amazing. So we all got used to that tea, and then it stopped. Obviously, we were like, when is that saffron tea coming back? Because I think not everybody can make a good saffron tea, especially with milk. Right?
Oh, okay.
I make my saffron teas without milk. It's more like the flavor of the saffron itself. But that one had an interesting set of flavors by itself. But that's the only time I remember drinking more milky saffron tea. But otherwise, I think I like it as, I think it has a very delicate flavor.
Absolutely. So you should try Kashmiri kahwa. So just boil some water with saffron and then add the special Kashmiri leaves. So I'll send you some and you should try that. Kashmiri kahwa.
Yeah. All right. So I think we will, this was a spontaneous, fantastic episode. We had a great time chatting.
Thank you.
So thank you, Dr. Ashwani. It was a pleasure. Thank you for doing this on a very, very short notice.
Thank you. The pleasure is all mine, and thank you for the opportunity.